Everyone, please get settled to your seats. We're about to start the session.
Oh yeah, we've only got that in stages. Picking it up with the alteration. You know? That was Alex's idea to go to sleep. We got a bad one. Yeah. Yeah, exactly.
And then, you've got the last left back to use back afterwards.
Yeah. And he's got it for any other competitions that come up and stuff, whatever.
And Chase Finance, I told Justin, and they told me that the money should be in your account by Friday. But it's all in process. Don't worry, it's coming back.
And he looks at these things right.
I bet he does.
Sorry to interrupt, but yeah, especially the jack, and you got a nice white shirt. Because I read it, you would supply the tie and then.
That's right. I was just saying, I've got a lot in it. I found a nice tie, like a mirror's cut, and a little box square to match.
Oh, and we got nice shoes for him. But we bought them in free.
I won't go wrong with it.
Well, then you want to buy it. It's like,
Firstly, I'd like to welcome everyone to the Learn Disability Conference. So I would like to give you a small briefing about this conference. It's about health and well-being of people with a learning disability. We know that people with a learning disability don't always have the best healthcare compared to people without a learning disability. And at a greater risk of developing different health conditions. Much of this can be stopped by things like annual health checks, promoting accessible health, specialist training for health and social care, as a lot of you might be aware of, our disability awareness training we all give to different organisations, and better access to healthcare, support to lead more active and socially engaging and happy lives. This conference will tell us all about lots of different things that can help improve people's health and keep them happy and healthy. So, bear with me. So welcome everyone, thank goodness. Firstly, welcome to the conference Love Your Health. My name is Zara Kaleem and I'm a member and paid staff of Newport People First, and I will be chairing today's conference. So, like I said, today's Learn Disability Wales conference is Love Your Health, and I just in advance would like to say thank you to Zoe and the rest of the Learn Disability Wales team for thinking me competent for this. Thank you. So today is all about health and well-being, and we are going to hear from lots of different people about the different ways to get healthy and stay healthy and improve our well-being. Last week this conference was in North Wales with a different audience, and it is great to be part of this the conference here in Newport with you today. In advance, I would like to say a massive and special thanks to our sponsors, Pobble, Mirrors, Drive, Careers Wales and Dementias. Thank you all so much. So at each of your tables, you'll have a delegate pack that will explain to you everything that is going on and what workshops you are booked on. But don't worry if you have not booked your workshop. please go to the reception during the coffee break to make your choice of your workshop. So don't worry if you haven't booked as soon as possible. There's a choice of going to the reception during the coffee break. And I probably said just now, you all have a delicate pack that will tell you everything that is going on and workshops, and I'm repeating, sorry. If you've got any issues and problems during the day, you can speak to a member of the staff from the Learning Disability Wales team. They'll be wearing the red t-shirts, and there are a couple of people wearing the Gig Buddy Cymraeg shirts too. So I would like to update everyone about the practical side of the entire event. Here's the list. The toilets are straight through the doors there. Gents on the left, and the ladies and the disabled toilets on the right. So yeah, first right and first left is the gents and ladies toilets, and during the breaks, the tea and coffee room is right behind you, as you're also aware. Lunch will also be in this room as well. And please turn your mobiles off on silent. Please don't use any flash photography. We will be taking our own pictures for social media's sake, and if you're camera shy or you're not comfy with having your picture taken, please let the member of staff from Learning Disability Wales know. They're in the red shirts. And there shouldn't be a case of fire, but in case of a fire emergency, the nearest fire exit is right here by the stage, and also at the back, right by the toilet, a few doors down. On the right side, yeah. But we will be directed if there's a fire emergency. So yeah. Also, I'd like to introduce Zoe, the CEO of Learning Disability Wales, who is our first speaker.
Thank you, Zara, and thank you for agreeing to chair our conference today. Well, good morning, bore da, croeso, welcome. It's so nice to be back in the room. As soon as I arrived this morning, I started smiling, and generally I attend the conference and smile for the whole day. And that's because we get to make great connections, and that's one of the most important things that Learning Disability Wales do, is make connections. I know that I speak for most of the staff when I say it's their favourite day of the year. Simon, Lucy and Iwan, the verdict's out for them because they've been doing the organising, but I'm sure by the end of the day they'll agree with me. It's the day we get to meet our members and chat to everybody, find out what's going on. And for us, it's been the nucleus of important projects at Learning Disability Wales. It was 6 years ago at this conference, just in the restaurant behind the walkway there, that we sat down and chatted, or member of staff sat down and chatted with First Choice Housing, and we talked to them about an exciting project we knew about called Gig Buddies, and they said, you know what, we'd love to partner with you on that, we'll give you £3,000. And we were skipping around the room with the £3,000, and we were going to launch Gig Buddies on £3,000. And 6 years later, that project exists in 11 local authorities across Wales, and is growing, and I'll talk a little about the plans for that later on. But that's what's really important about being at the conference and chatting to people, connecting. And for us at Learning Disability Wales, it's been the theme, particularly since I came into post, around networking, connections and partnership. And I think it's what we do best at Learning Disability Wales. At our stand, we've got our annual report, and you can find out what we did last year. It's always a bit strange, isn't it? Come and learn about what we did last year. But you can chat to the staff and learn about our priorities for this year. So in the annual report, it talks about some of our main achievements, and I'm going to just go through a few of them. It's through our networks and our great partnership working that we were able to launch last year the cross-party group on learning disability and ensure that the issues that people face are at the forefront of change makers, and we were able to share the issues with politicians in Welsh Government, and we were able to do that in partnership with All Wales People First, All Wales Parents and Carers Forum, Down Syndrome Association, Cymorth Cymru, Mencap Cymru and ourselves as part of the Learning Disability Consortium. And we've had already some important successes, and we've brought to light important issues. One in particular around the bus passes, and our chair, Sioned Williams, MS, was able to ask a question to the First Minister and launch a report into bus passes and the challenges that people have getting their bus pass in Wales. One of the other pieces of work we did and is included in the annual conference, annual report, is reducing restrictive practice. And we rolled out 5 workshops in partnership with Improvement Cymru and Social Care Wales. And those workshops were for people with a learning disability to really understand what restrictive practice is and to feel empowered to challenge when they feel that they're being restricted as people. And the final piece of work that I'll highlight that was in the annual report is our Easy Read service. Our Easy Read service exists, and their main business, I suppose, is translating other people's information. So we get lots of requests from Welsh Government, charities, public sector and statutory sector on translating documents. But one of the things we know is that there is information that's missing out of there. So we asked our members, we asked you, what were the things that were missing at the moment? And you came back and told us that there wasn't good quality easy read information on the menopause. So we worked with some partners, the Menopause Charity and Fair Treatment for Women in Wales and Cwmtaf People First to produce a range of information around the menopause in easy read, and they're available at our stand today for you as well. We also had run free training sessions in easy read. It's an income generator for us, our Easy Read service, but we're also passionate that other people learn how to produce easy read information, and that's our goal really, to be out of business within 10 to 15 years because everybody else is capable of producing easy read information. So we trained 150 people across Wales through 10 workshops for free, and that's a goal for us to increase the number of people who are able to write good quality information in easy read. Looking forward to the next year, we'll be working on inclusive education, ensuring that we really understand what's meant by inclusive education in Wales. We spend a lot of our time encouraging non-disabled people to understand the challenges of disabled people. And I think it's my opinion and the opinion of Learning Disability Wales that we do a much better job of that if we had a fully inclusive education system in Wales and an education system that understood people with a learning disability and children with a learning disability, and we wouldn't have to do as much work as we do challenging the stigma at a later age. We're also going to be working on gig buddies. I spoke about it being in 11 local authorities and the challenges of making sure it's there year in year and making sure that we've got gig buddies projects across Wales. So we're currently doing a piece of work to look at how gig buddies can best be itself and increase across Wales, and that doesn't mean that Learning Disability Wales would own it. Could mean somebody else owns it, could be other projects, other people starting their own versions of the project. So we're doing a big piece of work on that and ensuring that Gig Buddies is here in 10 years' time and is working in more local authorities across Wales. We've also just finished the delivery part of Engage to Change project, the employment project for young people, and we've been granted some extra funds to ensure that a few things happen in Wales, that there is a national job coaching model to support people with a learning disability to get into jobs in Wales. And another piece of work is our anti-racist work, and we're working in partnership there again with Hijinks and Disability Arts Cymru to ensure that as an organisation and as other organisations we're able to understand how we provide services in an anti-racist way. And the team from Hijinks are at the back of the hall there with that stand and more information on that project. The other thing I've got to tell you is that we're launching our Easy Read pages on the website, and so we've got some of our information on our website now available in Easy Read, and it's quite simple to find. It's just a big red button saying Easy Read at the top of our website. So if you want to go on and have a look, or visit our stand, and they can share that with you. The final thing I have to do is to let you know that we are on social media today, and please upload your photos. I'm going to ask Zara back to the stage to take a selfie with you all in the background, and use the hashtag #LoveYourHealth23. So if you are putting on things on social media today, or if you need some time to think about it and go back and have a think about what the conference meant to you tomorrow or the day after or over the next week, please do use the hashtag so that we can share that. So Zara, if you're ready for your close-up, we'll do a selfie. Okay, if you can all put your hands in the air, please. Lovely, thank you very much.
That was very well said, Zoe. Well done.
Thank you.
Thank you so much for that, Zoe. Next up on stage, I would like to call tell us more about annual health checks. We have Joe and Chloe from Drive, and Edward Eloidy from the University of South Wales. Please welcome on stage.
Good morning, everyone. Hello.
Good morning, everyone. My name is Edward Oloidi, and I am a very popular guy because of my strong Welsh accent. I usually start my conversations with that because people tend to ask me later, why can't you just tone down that accent? So I want people well in advance, okay? And I'm going to be doing this with my colleagues here. Chloe.
Hi, good morning.
And Joe.
Hello.
From Drive. I am from the University of South Wales. So what are we going to talk to you about? We are going to be talking about annual health check, which Chloe will lead on, and then we will.
They've given me the trust of that.
And then we will talk to you about some of what we found concerning annual health check as it involves people with learning disability during the pandemic research. And then we will also listen to the experiences of some members of Drive about annual health check, access, lack of access,
Yeah.
and stuff like that.
Yeah.
So at this stage, I'm going to hand you over to Chloe on the file.
Yeah. So, good morning, everyone. Hopefully, we've all got here safe and sound. As we said, I'm Chloe, and I'm the ambassador for Penslew here at Drive UK. So, what is an annual health check? So, it is when the doctor checks that your body and your health, your mental, your physical, your well-being is all healthy. And then they take place once a year. Now, you should get a letter every single year. Who in here has an annual health check? Can you put your hands up, please? Fab, fab, fab. So we've still got some missing. Okay. All individuals with a learning disability are from the age 14 and up. So when you start a comprehensive school or secondary school, or however you want to say it, that's where you start having your annual health check, and it should take place once a year. What happens at an annual health check? So, the doctor talks to you again about how you're feeling, about your mental health, if there's any worries, if you are comfortable in the appointment. They also talk to you about the medication that you're taking. Hands up anybody who's on medication. Fab, myself included. So they talk to you about all the medication you're on, or anything that you may need to have in the future. The doctor will also check your heart rate and blood pressure. So that blood pressure is the one that goes on your arm, and the heart rate is on your chest. The doctor will also weigh you. Now this one for us is a big one, because a lot of our supported young people also have a lot of issues with their weight. So they may also be able to ask for a water sample. Now this doesn't always happen, but it can. So if they ask you to take a water sample or wee sample, however you want to say it, that will basically let you know that if you've got anything internal that they can test through that sample. And now I will hand over to Ed for the COVID result. Ed, you are.
Okay. Sorry about that.
Technical issue.
Yeah. Add that to the fact that I am not very technical as well. So yeah. At this stage, I'm just going to tell you about some of the findings from a COVID, UK-wide COVID study. For the benefit of this conversation, I am going to be pulling out information that relates to health check. We started a UK-wide study in 2020. I mean, obviously we've got Learning Disability Wales, Wales People First, and other colleagues who are here today were part of that study. And in 2021, we started asking questions around the health check, because having done our first wave of data collection, that was one of the things that really came out very strongly. But before I go into that, we all know that it's a well-documented, fact that people with learning disabilities have got very health support needs. However, what we've also found out from the field I work in is that despite this being a well-documented fact, people are not getting the right support in terms of access to health care and support with other needs. So as part of the study that we did, we asked people if individuals have had their annual health check. This is very important for people as an opportunity to pick out where their health states are at the time or what could be emerging, and then to be able to deal with them on time. So we had to ask people this question because in COVID, when everything was shut down, we were all struggling to access our GPs, to get appointment, to go to surgery and all those. And then realizing the fact that we were at the time doing a study that we know, we are working with people who need all this care or support or access to be able to keep, their daily living and health going. We have to ask that question. So we started asking. So we checked, we spoke to people in 2021 and 2022. And let me say this was or is a UK-wide study where we spoke, to people with learning disability all around the UK. We spoke in 2021 with 99 people all across the UK, and in 2022 rather, we spoke with 747 people. We realized at the time that not everybody will be able to speak to us directly. It was an online study, a new thing for myself and for anybody who might have, been forced to start working online at the time. I have never been involved in a study that had to be conducted online before, so I can imagine what other people feel about that. So we knew this wouldn't be a straightforward thing, and we tried as much as possible not to miss out on the views of everybody. So what we did was, we approached the study by directly talking to individuals whom at the time were comfortable to talk to us online directly. And then we went via the support of family carers and support staff to be able to talk in particular to people with complex learning disabilities or complex needs. So that we were not missing out on all those bills, and that was how we did it. So we went for cohort 1 and cohort 2. Cohort 1 were people that were able to directly speak to us. Cohort 2 were people whom the family or support staff spoke on their behalf. And we spoke about health check in particular in 2021 and 2022. So what made this study particularly important to us in Wales is that without the participation or the support of people in Wales, I personally, I am of the opinion that the UK-wide study wouldn't be a success. Because at every wave of the study that we spoke to people, 1 in 5 are people from Wales. So Wales contributed to the study itself more than any other UK nation. Now, bear in mind that we were supposed to contribute less, at least from what the sample size was meant to look like. But at the end of the day, Wales made the study itself a success. So at this point, I want us to clap for Wales. Thank you very much. Thank you. It is one thing to stand here today and talk about a UK-wide study. It's another thing to talk about the involvement of Wales, because that is the only reason why we are standing here talking about this. Right. So, these are numbers. I have tried as much as possible to water this down because I don't want to bore anybody. If, having talked about this number, people want to ask me any question after this conversation, please feel free. I have had to take out the percentage in terms of what this represents and all those stuff so that I wouldn't confuse or bore nobody. But I'm very happy to provide whatever response or answers that people might miss out on as a result of what I'm about to go into. So, on my side here, what I have tried to do is to show the people in cohort 1, which is in 2021 and 2022, and the people in cohort 2, again, 2021, 2022. What I meant by that is this. The people here are those individuals who were able to talk to us, people who said that they were comfortable to talk to our researchers. In cohort 2 are people with complex learning disability, whom the family or the support staff spoke to us on their behalf, okay? So, we asked people in 2021, those who spoke to us directly. We spoke to in cohort 1, we spoke to 621 people about their annual health check. Have you had an annual health check? And the answers are, the guy in green simplified those who said yes. And the guy in, what do I call that color? Is it red? Are the people that said, no, we haven't. Now, so in 2021, the people in cohort 1, 255 people said yes, we have had our annual health check. 366 said no. And when you think about the significance of annual health check, both to people with learning disabilities and the people without, you think about only 621, because these are the people that we spoke to. What about the ones that we don't even know, the people that did not even take part? And we had that number, 366 people who said no at the time. When we spoke again to individuals in 2022, at the time, we were only able to speak to 477 people in cohort 1. And only 210 said yes. Now, that number has reduced further. If you take a closer look, it's gone down. And then, we had 267 people who said no. We conducted a longitudinal study, and the problem with that type of study is people will drop off as the study goes on. They get bored. Nobody wants to be asking questions over and over again. But it's the only way we can monitor things and see how the trend is going. But at the time, we were only able to speak to this number in this cohort, and that is the figure we had. Again, when we spoke to the people in cohort 2, we spoke to the staff or the family carers about their health check. In 2021, we spoke to 378 people, And only 129 people with complex need, we all know that they've got quite a lot of health need support. And yet, in that number, we were only able to get 129 people who confirmed, yes, I have had my annual health check. The remaining, no. Again, these are the people that spoke to us. What about the ones that didn't talk to us? We don't even know about their experience yet. Now, in 2022, we were only able to speak to 270. Yes, you think this is a good number because it's gone up, more than what it was. But still, we still had like 151 people who said no. So at that point, what we did was, in that 2022, we asked people, what platform were you able to see your GP? Did you have it done by phone? Because we realized talking to individuals that people were saying, they phoned me and asked questions. We all know that people who went in haven't had the right service, not to talk of people being spoken to on the phone. So we asked people, if you have had your annual health check, how did you have it done? And in cohort 1, 56 people, that is among the people that said yes, said they were able to go in. Then we had another 11 people who said, it was done on phone or online. In cohort 2, we had 35 people who said, yes, I was able to go in. And then we had another 10 who said online. So we felt, what is the quality of this thing? What was the experience that these people had to go to? How do you rate this experience? So we had that question, and individuals told us, well, luckily enough, at least in this cohort, we had 50 people who rated it as good. But in this cohort, family, carers, or support staff, we had only 20 people who said, yes, I had a good experience. So in a way, it simply shows that not everybody was satisfied with what they had to go through. So, without me boring you too much, because I have to go for my colleague to take over, I can talk for Welsh, despite my Welsh accent. So, there you go. In 2021, what we found from what I've been talking about all day is that fewer people had, their health check done in 2021 as compared to what we had in 2022. And if you look at the number I showed earlier, you could see that, you could see the increase. And this is only because we put the two cohorts together. It shows again that COVID continues to affect people's lives. Because by the time we're asking people again in 2022, that was toward the end of all the lockdown, we're gaining some access and all this. It shows that COVID is still very much in the life of people, and it is still, even though people like us will say, we are back out, we can do this. You can't say the same thing about people with complex needs. Many people cannot go back to where they used to go to.
No.
All because of what COVID has done. So it is one thing for you and I to say, yes, things are back to normal. When we speak to somebody else, we will see that the experience is totally different. We noted that services haven't gone back, to people with COVID. And I'm very sure many people will say yes to that, because I'm very sure that there are still things that we used to do that we can't do. Some day services are still not functioning as we speak. And that's an example of what COVID has done again to many people. Even though you and I will work out there and say things are back to normal, I don't think things are back to normal. No. People with complex needs, especially, we all know that daily life continues to be a struggle because people can't do what they used to do before. And all these, as far as my own understanding of research is concerned, only show one thing: inequalities. It's always been there, but it's getting worse. Particularly for people with learning disabilities, and in particular from an healthcare service perspective for those with complex needs. It is getting worse.
Yeah.
So I think we still have a long way to go. Thank you very much.
So, I'm Jo. Some of you know me already. I'm the co-production manager at Drive. We've started talking to people that we support about their current experiences of annual health checks. We haven't spoken to many so far, but we intend to speak to a lot more. And we've made a short video of their experiences. The people in the video talk of quite positive experiences, but we do know of others with not so good experiences. So enjoy the video. There's no sound.
Good sound, Fraser.
Oh, Jesus. You have to talk over it, Flo.
I know. Anything that they are worried about.
Yay!
Yeah, I'll restart
Thank
it.
you.
Yeah.
Yeah.
Keep you healthy and strong.
Annual health checks. Individuals supported by Drive told us about their experiences. Have you heard about annual health checks?
Yeah, it's something that a disabled person of any disability should have once a year to check everything from their mental health to physical and anything that they are worried about.
Keep you healthy and strong. You have to check with a doctor, making sure you're okay.
When you go to the doctors, you've got to be examined to be healthy, to make sure you're all healthy.
Have you had an annual health check recently?
Yes, I had one 2 weeks ago Monday, and it was not the normal appointment that I've experienced.
No, not yet.
Last week. Yeah, I had it not long ago.
What was your experience?
So normally it's an hour to an hour and a half, and you have one nurse and one doctor. But my appointment was only 10 minutes, and they were going through a check sheet to say tick, 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 all done, and that was it. And I was out the door. It wasn't even, I didn't have a physical or nothing.
Ask me how I feel it. Blood pressure. I go on the scales as well.
Great, everything was fine on my health check. I was in there for about an hour with me. They check everything really. My weight, my blood pressure, to make sure that's okay. Yeah, they ask how I'm feeling. They give me a thorough check.
Who reminds you about your annual health check?
So I get a letter from the doctor, but I also have reminders from staff at Penslew who just say like, don't forget we've got a book for this, this and this.
A letter. The staff. And I get a letter through.
Because they got to phone my GP to book an appointment. The staff phone for me.
During the check, does the doctor explain what they are doing?
They used to, because I used to have one nurse and one doctor, and they used to take that time of explaining every single thing bit by bit, but now they just go through everything to say, how's this, how's that, and then it's done. They're not taking that time, even just to let that person chill out before the appointment actually starts.
They do explain what they're doing and what they're gonna do. Yeah, they explain everything.
Do you think annual health checks are important?
Yeah, I do think they're very important because it gives that person an opportunity to look at their mental health, their physical health, and anything that they are worried about.
You feeling well if you don't have it?
Very important. If anything goes wrong, they can treat you for the right illness and whatever you've got.
Nearly everyone we spoke to had an annual health check recently. Some people told us they had an invite letter and others had to ring their doctors. There were some people supported by Drive who were not given an annual health check by their doctor.
Do come and talk to us on our drive stand if you'd like some more information. Thank you.
So, yeah, hi again. So basically, thank you to Joe for asking me to be part of that video. And thank you to the guys, Simon and what were the other two ladies' names? Rachel and Claire, who also did take part. It was obviously very nerve-wracking for them to do it as well as me. It's a brilliant privilege to be here today. But yeah, thank you so much. And as you guys hear, everybody with learning disability, whether that's physical, mental, whatever, needs an annual health check. And I put the capital in needs because it's important to us. So yeah, if there's any questions, please do come and find me. Myself, Joe and Ed. Yeah.
Sorry, I've gone the wrong way now.
Oh yeah.
What am I doing?
What?
I don't know what you're doing.
I don't know.
Is there another slide after that way?
Just the other video.
Okay, that's fine.
Yeah.
That is the end.
Yeah.
Sorry.
They're not very good with technical, as you can see. And Ed, you didn't need a microphone by the end of it. But yeah, thank you for listening to us. And if you do have any questions throughout the day, please do come and find us, and we'll be more than happy to help. Thank you.
Thank you very much, Joe, Chloe and Edward. That was a very inspirational and thoughtful part on your side. Thank you so much for that. Now we have Jonathan Ridge, who is going to tell us about improving healthcare for people with a learning disability and what the Paul Rudd Foundation does. Please welcome on stage, Jonathan.
Yeah, first of all, thanks once again for the invite from Learning Disability Wales. Fantastic conference, what a turnout. Brilliant to see so many familiar faces and so much work, brilliant work going on by various organisations and people. Yeah, so the Paul Rudd Foundation was set up, is predominantly focused on improving healthcare for people with a learning disability in secondary care, although we do campaign for primary care as well. Just keep jumping. So, just quickly on our logo then, so we come up with this logo back in about 2014. I have no idea why this jumping all the time. Sorry.
There we are. You're staying on the logo, yeah?
Thank you. Sorry, I got to click that in. Yeah, so, yeah, with regards to the logo, let's jump off this quickly. Yeah, so with regards to the logo, it's a communication bubble, is to promote patient-centred care. And again, back in that day, it was the traffic light system, so red, amber and green, which is now the health profile, the importance of that information. So, just want to quickly go through Paul's story, a shortened version. So, Paul was born with, unfortunately, with a cord on his neck. He was left with a trainee midwife, didn't cut the cord quick enough, which then done severe damage to his brain. It wasn't known until Paul was around 2 years of age that he wasn't developing. And then he was taken for numerous tests that then our parents found out that what happened to Paul at his birth. They then took Paul to Great Ormond Street to see various consultants, done various tests on him, only to discover that what had happened at Paul's birth, the damage was irreversible and it was a permanent condition. So Paul, up until the age of 9, lived with our parents in Bertalbert, in the family home in Bertalbert there. Until then, he developed pedomal fits, of which then he required 24-hour care. Paul then was taken off by healthcare, social care professionals to Hensel Castle then, which he spent the next 36 years of his life. As you can imagine, all the parents in the room here, you know, for a 9-year-old son to be just taken away from you with no sort of consultation, not much discussion, just Paul has to go, was obviously a very, very difficult situation for our parents. Unfortunately, that was the only place that you know, was available to Paul at the time to give him the care that he needed. So Paul spent, like I say, 36 years at Hensel, had various sort of ups and downs there. As a family, we visited Paul on a weekly basis, sometimes more than that. So again, our parents made sure that Jane and I, my sister, we were very much part of Paul's life. Paul then came from Hensel to a purpose-built bungalow in Neath and Bertalbert, where we live, in Britain Ferry there, in 2001, which then gave us a lot more access to Paul in terms of we could pop in to see him and be a much, much bigger part of his life then. We didn't have that travel restriction. So throughout Paul's life, he had numerous health challenges, one of the biggest one being a lazy bowel. So at his time in Hensel, he had 2 operations in East Glamorgan, where his bowel had blocked up. There wasn't much they could do, so they cut sections of it away. This continued then when he lived in the bungalow, and on numerous occasions, the same thing would happen. He would then be taken to the GP, and he would be given Movicol, that sort of thing, and be sent away, you know. And again, you know, taking him to the GP with an incredibly swollen sort of stomach, and no other investigation was taking place at that time. So when you talk about annual health checks, you know, it's so important, and the quality of annual health checks, and that's something that was missed at the time with Paul, that further investigation or options weren't looked at that time. In 2008 then, late December 2008, the reoccurring problem, Paul ended up in Singleton Hospital, taken into theatre, fixed the problem temporarily, of which he came out 3 days later. He then, a week later, which was New Year's Eve 2008, he was taken into Morriston Hospital because the problem reoccurred again, because they just done a temporary fix at Singleton. But this time his bowel had perforated, and then Paul had sepsis, so he had then further complications from that, taken into Morriston Hospital. He underwent a 7-hour operation. Surgeon done a fantastic job in keeping Paul alive, of which then he ended up on ITU for 21 days then, of which was again another challenge of Paul having such a major operation, is trying to get him off a ventilator. During this time, Paul developed lipid pneumonia, which we weren't really sort of made aware of by the consultants. We just overheard the conversation. So again, it was like, same thing with the GP, that when you would take Paul into healthcare, that it was a fear of the staff, of the unknown. How do we deal with him? You know, how is he going to react to this? Paul had a profound learning disability. He was non-verbal. So again, we had to communicate for Paul, but it was a real challenge to get them to listen to what we were saying. So Paul came off ITU, went on to general ward quite prematurely, still had aggressive pneumonia. He had tracheotomy while he was on ITU, which would remove the secretions, put him on a general ward, removed the tracheotomy very quickly. And then 3 days later, Paul went extremely flat. He was very unwell. We kept telling the staff on G-Ward in Morriston, which was literally opposite ITU, that there's something not right. He looks really flat. He's very clammy. And then that night he was with his care manager. So during the day my sister would spend all the time, I'd spend the night times with him just to have a familiar face, and he'd also have carers with him. And then the night Paul passed away, the doctor walked past and said he didn't go in to see Paul. He just said, after being told he was clammy and he was flat, he's agitated, give him diazepam, which then brought on his death much quicker. So, as you can imagine, quite a bit of a traumatic experience for the family, very confused, didn't know what was going on, but we knew that we needed to do something about it. We needed to make some change. We needed to make some change around the fear of healthcare professionals treating people with a learning disability. So we just wrote a number of questions then. After Paul's death, we wrote to the coroner, we wrote to Swansea Bay Health Board, and again had a number of meetings and went through the questions, of which they answered all the soft questions around nursing care, very much blamed on nursing care. But as we saw it, the medics let Paul down. They just wanted to rush him out of ITU onto a general ward. He was just a statistic, unfortunately. So we then took that further then to the complaints department, which they couldn't handle. It was too complex. Ended up with the Ombudsman, who then listened to us and went through a thorough investigation, and the Ombudsman, unfortunately, upheld then all of our complaint virtually. So there was a POVA report, and then also a couple of days after Paul's death, Jane and I went to see the coroner at Swansea, again because we'd written to him because we wanted an independent post-mortem. And this is something will live with me forever, is that as we were walking to the door, he said that if this is about compensation, then your brother's life wasn't worth anything. Which again was based on, having a family, based on a job and all those type of things. We hadn't even got to the door. But later down the line, when we had the inquest, he then apologised to us because there was a verdict given then of Paul died of gross neglect, which then gave us a platform to try and create positive change. So the key Ombudsman's recommendations came out, and majority was around awareness training, a lack of awareness training, robust supervisions of doctors, and then sort of care plans, which are now in place today. And again, this gave us a platform to change as a family. So we just went out. Obviously, we were going through a grieving process, and we used that energy then to go out and try and campaign to the UK government, Welsh government, to see how we could raise this awareness effectively, if you like. So the key milestones of the change of the Paul Reid Foundation, the launch of the Pathway Care Bundle, which was by the Health Minister, which Mark Drakeford in 2014. So there's now a care bundle out there. It's been there since 2014. That was sent to every health board. It's literally 7 interventions because we were very mindful. We sat on sort of a group, then if you like, to input into this. We were very mindful of healthcare professionals not having more work to do, another care plan. So literally it's 7 interventions. Then we created the logo pack because there was a gap then of an indicator. How do you sort of know a person has a learning disability when they go in to access secondary care? So we created the logo, we created logo packs then, and we distributed them across Wales to every health board, every department in Wales there. So it's just a gentle reminder, little bit of a sticker on the note, so if a person goes from the ward to X-ray, that even the porter knows that that person has a learning disability, and they might have to consider them making a reasonable adjustment. And also we have trained, so we could see a gap at that point in terms of the training, and this was a lot around awareness again, and not being supported within the services. It's great launching a a care bundle. But again, if nobody knows but they haven't had any training, then it's very difficult for them to sort of change the way they respond to people with learning disabilities. So we have trained over 4,500 champions on wards and departments across Wales, and all of that has predominantly been done face to face. But somebody said to us way back when, if you're going to create lasting change, then things need to become mandatory. So we petitioned the Welsh Government, raised over 5,000 signatures in 2018-19, which again, the debate was unanimous, and the process then of mandatory training started. So mandatory training has been developed. It was then given to USW to develop a framework. So it has 3 tiers. The tier 1 was then made available in April 2022. But something that we've realised as a charity is that when we follow up things and we look at numbers, we have numerous meetings with the Welsh Government, with the health boards. I had a lot of contact over the time, and you get to the fact of how many people have done the training, and it was very, very little uptake. And that could be that the training was posted on the wrong part of a learning platform, which is crazy. So my colleague Bridget does a fantastic job in prodding these people on a weekly basis to get these numbers up and try and promote this training, because we see it as key. Again, we go and share Paul's story and the work that's been done and what is available more than anything to the universities across Wales, because we just look at how can we make an impact on the ground. And that's what the charity has done from the very, very start, is going everything that we do, how do we make an impact right at the coalface, right on the ground? How is it going to make a difference to a person with a learning disability? So then we thought, right, we need to get into the universities, and we've been doing that now for 6 or 7 years, is speaking to the first year students, second year students in nursing across Wales, again, just to make them aware of this. And also the training now has also been made mandatory for them, so you're catching people much earlier. So again, it's like a 360 approach in a way. We spent so much time focusing on challenging the health boards, challenging the Welsh Government of how they could improve healthcare. So we thought, now we need to educate people with a learning disability, carers, families, to make this information available to them. So we've done a number of road shows, and we've got booklets like this, which has also been put into Easy Read, thanks to the support of Learning Disability Wales. And they are available then at the back on the Improvement Cymru stand there with Laura. Yeah, so we've done these road shows across Wales. We were fortunate to be in North Wales last week again at the conference, and we've done our own road show the day before to promote this information. So going forward, we have some future plans. We've had to sort of change our approach in a way that now that the mandatory training is sort of in place, we'll continue to push the Welsh Government, to push the health boards, to make sure these numbers are right and they are doing things and support families and carers. But we want to go now from a family and carer approach in a way that the work that's being done is to empower people to go into hospital and say, you know, use my health profile. This is the information on me, so they're equipped with that. What about the care bundle? Are you following the care bundle? So to ask all the right questions and to come from a different direction then, if you like, to challenge them, to make sure that they do have the health care that they deserve. Thank you.
Thank you, Jonathan. That was really heartfelt, and we're really sorry for your loss. Well, sorry. We are now having our first break of the day. Teas and coffees are served in the exhibition room right behind you. And please remember, I'd like to remind you that if you have not signed up for the workshops yet, now is your chance to visit the registration desk and make your choices. And we will restart the event at 11:20. Diane, diolch. Diolch yn fawr.
Alex, can I grab you?
Hello, just realised 35 minutes I'm late and reminding you all that the break is it's gone 11, well over 11 past 20 past 11, so sorry about that, that's my stupidity. But welcome back everyone. I hope you had a chance to visit our exhibitions during the break. We now have Joanna Jones, Stacey Trailer and Stacey Rees and Edward Eloidy to tell us all about health profiles. Can you please welcome Edward, Stacey Rees, Stacey Trailer and Joanna, please. Hello everyone, hope you're okay.
Hi everyone.
So today with me is Edward, Joanna and Stacey. We're going to be talking a bit on the health profiles.
Yeah, just wait for Ed a minute.
Come on, Ed.
Okay, so thank you, Joe. So my name's Stacey and I'm a lecturer at the University of South Wales. And this morning we're going to talk to you about the health profile. Edwin and I are going to talk briefly about how we develop the health profile at the university. And then Stacey and Joanna are going to talk about the brilliant work they've done to empower and support people with their own health profiles. And they've done some fantastic work. Let me move the slide. Oh yeah. So a bit of background to the health profile, how we develop the health profile. So the health inequalities that people with learning disabilities face are heavily evident. We all know about the health inequalities, and the reports that talk about these health inequalities, they always talk about the use of communication tools. And at the university, back in 2017, we did a review and we looked at all the different health communication tools that were being used across the UK. And how many tools do you think that we found being used across England, Scotland, Wales and Ireland? Anyone want to have a guess? How many? None? Oh. No, we found 60 different tools that were being used. So loads of different tools that were being used across the 4 countries. And these tools, they really varied in terms of what they included. So some of these tools were 60 pages long. So think about that, a person going into hospital poorly, and they've got a tool with them that's 60 pages long. Do you think the doctor and the nurse would think, right, okay, this person's poorly, I'm rushed for time, I'm going to read 60 pages? No. So there was lots of problems in terms of what was included within these tools. Some tools were one page long, like I said, 60 pages long, and there was lots of differences in terms of what was included in the tools. For example, lots of the tools didn't even include information such as allergies, really important information to keep people safe. So what we did as part of this research study, we published it in a generic journal, Journal of Clinical Nursing, and we called for a Once for Wales communication tool. So what we did, we're going to talk now a little bit about the research that we did to develop this All Wales tool. Because what we sort of evidenced from the research that we did is that as well as how important person-centred care is, and we need to make sure that the care that's being delivered is person-centred, we also need to make sure that we are keeping people with learning disabilities safe when they are going into hospital or going into, you know, accessing healthcare. So we needed to find that balance around what was important to people with a learning disability and what is included within the tool, and also what information do doctors and nurses need when a person with a learning disability is admitted to hospital. What information do they need to keep people safe? So when we did the research, it was really important to us, and Ed will talk a little bit more about this when he talks about the research that we did. We needed to find that balance between person-centred care and patient safety, and the way that we did the research, speaking to people with learning disabilities, speaking to health professionals, hopefully, you know, we've done that in terms of the launch of the health profile. So that's a bit about the background. It started off with the research that we did, and then we were funded at the university by Improvement Cymru to develop an All Wales tool. And Edward is going to talk a bit about the research that we did to develop the tool that was launched back in June 2020. All right, Ed?
I think Stacey has already mentioned, you know, about the review of existing literature that we have to, you know, undertake, which includes having to identify the tools that were used at the time, quite a lot of them. So what we did was, we look at those existing information and the tools that were, you know, being used at the time, and we look at those information that were consistent across all these things, which showed that they were significant. Others have identified them as an important information for individuals to be able to, you know, use their health health passport or whatever it is that people were using at the time. So we used that to inform the information that we that kind of underpin the focus group that we undertook. We did 4 focus groups because the aim was we need to speak to people with learning disabilities. We need people to tell us what is important to them. What are their thoughts about things that will keep them safe when they go in for an appointment, things that will help them to be able to communicate their needs to whoever it is that they have gone in to see. As part of that as well, is Jane? No, I didn't. Okay. So yeah, we conducted 4 focus groups across Wales, North Wales, West Wales, Mid Wales, and so we asked people using photo symbols because we felt at the time as well, it is not just, communication is not a one-way thing, and it is not about words. It's about making it accessible so that people are able to have their input. So what we did was we went with photo symbols. We asked people in those focus groups to rate some information, pictorial information, according to what they think are important. So people were asked to rank those information in piles. Very important, important, not so important. Am I right? The 4. Yeah, I think it's 4. Very important, important, not so important, and don't know. Yes, and don't know. So, having done that, we then ask, with the ones that people don't know, we explain it. And then the group will tell us if they feel now this makes sense, we think it should be important or very important or not important. So that was how we went through that process until we arrived at the most important information as advised by the group that we work with. People told us at the time about that process as well, how difficult it was really in terms of having to rank. Why? Because they felt that there are information that is important to me that is not important to Stacey. Somebody cited the issue of religion. and saying, look, I am not a religious person, but somebody else who is religious might feel this is important. So that was quite, a task, really, a challenge that people, really had to go through. But eventually, with the support of the group that we work with, we managed to get there. Many people told us as part of that study as well that they were unaware of what health communication passport is, or whatever it is that people were using at the time.
At the time, it was probably the traffic light system or the hospital passport, but lots of people were unaware of the tools. Or if they did have a tool, they said that they didn't really use it because they found that it didn't really get looked at by hospital staff.
So, having done that, we spoke to people. What should this tool look like when it is developed? And some of the feedback we had was some people told us that they want it to be as big as 20 pages because they want all the information in. But again, coming from what Stacey said, it was about making it person-centered and making it safe. So we felt, okay, if we were to do this, this is what we think might be the danger. In an emergency situation, how do you manage when somebody needs to, to kind of address your need at that very point in an emergency? So people started to see where we were coming from. So eventually, we agreed with the group that it shouldn't be more than, oh my God, it's gone again. Is there? Sorry.
Hey, not getting into the technical yet.
So we come to the conclusion that, because we had more people who said, look, now we see where you're coming from. We want more pictures, but it shouldn't be more than 4 pages. And they also said we need to come up with a tool that is recognizable, something that stands out. And the rationale behind that is this. People felt we've got health file or health communication file or whatever, but if we have a document that stands out that everybody can recognize whenever we go in for appointment, then it makes things better. So we went for, what did we do then when we decided about the recognizable thing? I think
We wanted it to fit in with the branding within the NHS because we wanted the documentation to be sort of compulsory, so doctors and nurses would look for the health profile. So we didn't want it to be another piece of documentation that doctors and nurses needed to look at. We wanted it to fit in with the branding, and that's why the branding was chosen, wasn't it? The health profile and the colours and things to fit in with NHS branding.
And one area that really kind of stand out was people want information about health, about communication, about their support needs. They also said we need to create additional, a section for additional information because again it depends on the individual.
Yeah.
Anything you want to ask, please?
I think because it was, when we did the ranking exercise, it was so subjective, and what was important for one person wasn't important for another person. We decided with the group of stakeholders that we would have a further space, and if anyone thought something was important, they would have that space then within the health profile to include that, because we couldn't include everything that was important to everyone. So we had that extra space then for any additional information or extra information that was important to that person.
Yeah. We were also, advised about developing a guidance note that, people can look at to be able to complete their health profile.
So as well as the health profile, on the Improvement Cymru website there's guidance notes for people with a learning disability, health professionals, and family carers, isn't there? Yeah, and there's actually something else that's really important from the discussion that we had is that there's 2 different health profiles. There's a children and young person health profile, and is a health profile for adults. And what else, I suppose another thing that we talked about within the group was that this is a communication tool, so it should be used with anyone. It can be used with anyone with any communication difficulties. And I suppose when we spoke with different people, it was talked about using the tool for people with dementia, for example. So it should be used for anyone really with any sort of communication difficulty.
Even we found, because people told us that someone without communication difficulty can also use it. And I totally agree with that. I mean, you know, thinking about people whose English is their second language, for example, you know, I can do with this. I'm very sure about that. You know, so.
So guidance, the document is available in both English and Welsh on the People Cymru website, and the document is easy reading.
Easy
We've
read,
used
yeah.
photo symbols in terms of developing the content, and hopefully, how many of you are aware of the health profile?
I work on it as well. We contact people through.
Oh dear, brilliant. Oh, thank you. Most of you are aware of the health profile? No.
Do we know if there is a part of Wales that is still using something different to health profile? Because this is meant to be an all Wales document. Because it's another thing that we are concerned about, really. You know, again, trying to kind of, you know, erase the doubt. Because if it's not being you know, used as an all Wales stuff, then it might go missing again, and that is a concern, you know, with those families.
I'll go do this.
Stacey's my clicker today.
Oh, thanks,
She loves the
Joanna.
clicker.
I'm Mo's the guinea pig.
She loves the clicker. Okay.
So we're going to talk to you now about what we have done with the health profiles.
Okay, shall we introduce ourselves?
Yeah. So I'm Stacey, and I'm a healthcare support worker in the Vale of Glamorgan.
Hi, and I'm Joanna, and I'm a healthcare support worker in the Cardiff Learning Disability Health Team in Cardiff.
Do you want to start?
Brilliant. So, first off, thank you for the opportunity and the honour and the privilege to come and speak to you all today. It's made my day, and it's probably made Stacey's day, because it's one of my favourite topics of all time, health. So I love this topic, so there we go. So, the Once for Wales health profile makes me so excited. It helps people with a learning disability to get safer, smarter, better healthcare at the time they need it. People with a learning disability, their families and caregivers, as well as health professionals, were all involved in the design and final layout of the health profile. The health profile contains information about the person's health, care and support needs and communication. And if needed, someone you trust can help you to complete it.
Can you swap?
Mm-hmm.
Can I do that? So it is important to keep the health profile up to date. If needed, you can have extra pages at the back of the health profile. The health profile is a booklet that belongs to the person. It contains all the important information that the health professionals need to know in appointments. The health profile can be shown in the appointments of GPs, opticians, dentists, admissions to hospital and at any healthcare appointment. This is important for people with learning disabilities so they can get their voices heard. This means health professionals understand the person and the parents, carers, guardians don't have to speak for them. The Once for Wales health profile asks how best to communicate. For this question, people mention about not using jargon and having words that are not easy to read. Go on. Yeah, I done it.
Okay, it's okay. So, why do I get excited about the health profile? In 2020 and 2021, through the pandemic, we both worked together on a project named Our Health, Our Voice, with staff from Cardiff People First, professional people from Public Health Wales, and the local council as a team. And this was so exciting because before that, as Stacey had said, there were 60 different things around Wales, and now it's exciting because there's one Once for Wales health profile. Even when we go to medical training at the hospital, we go in concourse and there's a pop-up stand saying, have you got your health profile? It's now getting more into the NHS to be able to be a communication tool for people with a learning disability, and it's getting more recognised now, and it's just fantastic. It's getting recognised by other health professionals, and it's getting into the GP systems now, and people are asking their patients have they got their health profile, and it's getting used and it's amazing.
Yeah. So as the pandemic had started, we kept in touch with members on the telephone. But as restrictions started to ease, we were able to see our members in person with a 2-metre distance. This was really hard for members because obviously some lip read as well. So having a mask on, it was so difficult to speak to that person. And like some of them were deaf as well. So like, it was just hard. I think it's hard for everyone, but yeah.
Most of the health profiles we filled in for members was over the telephone or other social media platforms. We overcame barriers on this project and developed our skills.
Should I speak in the mic? This is better. I contributed to completing the health course for people in the Vale of Glamorgan, so that's Barry, because I live in Barry, so I completed health profiles in the Vale.
And I encouraged our members in Cardiff to have a health profile. If someone did not know about what one was, I took time to explain what it was all about and why having one is brilliant. I contributed to completing health profiles in Cardiff by filling in the booklets for our members over the phone and keeping all the information very safe and storing it correctly.
So between myself and Joanna, we have made between us 90 health profiles for members with learning disabilities to have a health profile for them.
And that was with our team as well at Cardiff People First and the wider team, which we're all grateful for. So we worked with Paula Phillips from Public Health Wales on an online survey to get feedback.
Then we offered training to professionals who work with people with learning disabilities on how to fill in a health profile. We helped to create 2 animation films, which we are going to show you today, if we've got time. Oh, where have I gone? There. With Public Health Wales for health professionals as people with learning disabilities.
A good thing about the health profile, and this excites me so much, it does really excite me so much, sorry, is that reasonable adjustments can happen in real life because of the health profile. For example, when I take my health profile to the dentist, I get to hold the water suction tube, and this helps take away anxiety. I can also wear the special glasses at the dentist. This helps me a lot because I do not like bright light shining in my eyes. I am grateful to having the health profile for this happening, as I showed my health profile to the dentist. And this is my famous, what I always say. So I always say that the allergy question can save a life. And I say this because if someone is known to be allergic to certain medications, then the health profile can alert a health professional quickly. And I also say this is important, for example, if somebody, for a random example, is allergic to, say, strawberry flavour. And this is a problem because if someone can't take medication or swallow it like a tablet, then they might need to take something like a version of Calpol, which is only in strawberry flavouring. So something like that is just a simple example, but that could save someone's life as well. So, also, if you would like a copy of a health profile, I've seen out in the lovely foyer that there is a Improvement Cymru Public Health Wales stand, and they have copies of a health profile. Okay.
What I also like about
waving at you at the back.
But what we also like about the health profiles is it's personalised to that person. So when we first started, we can't do it now, can we? We can make it like the nice fancy booklets. But if you do like one, please come and see us. Yeah, so like I said, feel free to come and speak to myself and Joanna about getting your own health profile. We can even help you fill it in if you wanted to. And more information in your free time here today. Thank you so much for listening to us, and thank you to Stacey Rees and Ed for letting us to have our say today. And we got a few quotes we like to give you that we think is really close to us.
Okay, so one that I wrote myself is, keep the passion alive so others can thrive.
And mine is really close to me. It says, a dream doesn't become reality through magic. It takes sweat, determination and hard work.
like to show you our videos that we produced with the guys and Paula.
Do you know that a person with a learning disability is likely to die up to 27 years earlier than they appear in the general population? And care failings often relate to challenges with communication. We have developed the Once for Wales health profile. It provides you with the key information that you need to provide safe and person-centred healthcare to people with a learning disability. People with a learning disability will bring the health profile to health appointments. The health profile includes information like how best to communicate, medication, allergies, and any reasonable adjustments a person may need. There are 2 different versions of the health profile, one for adults and one for children and young people. When you support a person with a learning disability, please ask them if they have the health profile. It is important that all health and social care professionals, including those in hospitals, primary care services, ambulance staff, opticians and dentists, read the health profile at the beginning of an appointment. It is also important for staff to tell any other colleagues or relevant professionals involved in the person's care that a health profile is available and that it must be read.
When someone is in hospital, the health profile should be available at the bedside and not tucked away in the medical note. The health profile must be kept up to date. Check with the person or those supporting them that the information is correct and nothing has changed. If someone with a learning disability comes in without their health profile, you can print one off and help them to complete it, or ask the carer to help them to complete it. Having blank templates of the health profile available or a link to download and print the health profile in your work area will be helpful. If any changes have been made when an individual is with you, for example, in relation to the medication they are prescribed, then this should be noted on the health profile. The health profile improves health outcomes for people with a learning disability. Please ask for it and please use it.
Because we're running a bit far behind, we just want to say thank you so much for listening to us today, and we hope you come to us and speak to us about the health profile.
Yes, thank you everybody for listening. Enjoy your day and keep loving your health. Thank you.
Thank you so much to Edward, Stacey, Reese, Joanna and Stacey Taylor, especially on those treasure-worthy words you've just said, and also the effort that you've made in making the Health Passport video. Well done. That just can't be commented enough. It's well done. And now we have our first set of workshops of the day. Your workshop choice and where the workshop is on the sheet given to you when you registered this morning. Like how the arts can help mental health and well-being workshop, that's in the working wall room. Healthy sex, sexuality and intimacy workshop is in the Caldecott room. Improving vaccine information will be in this room right here.
Actually, there's been a change. Sorry, Zara.
Oh.
Vaccine information is now in the Monmouth room,
Oh.
and Health Challenges and Solutions is here. Sorry, Zara, I
That's
didn't
cool.
tell you that I changed it.
What Simon said.
It's all right on the screen.
On the screen as well. My bad. Please go straight to your workshops now, and after your workshop, lunch will be served in the restaurant area. Thank you.
Welcome to Health Challenges and Solutions. He's delivering it. Very good. Shall we wait and see you too?
All okay? Yeah, good. So yeah, we're Hijinks. I'm Dan, I'm head of film at Hijinks, and I'm here with my colleagues Adam. you'd like to introduce yourself, Adam?
Yeah. Hi everybody, my name's Adam. I'm a hijinks actor. I've been with Hijinks 6 years now, and we are a theatre company who make theatre and film and all sorts of other things, and we work with actors with or without, and with, sorry. Okay. With and without learning disabilities and or autism.
Thanks, Adam. And we also have Lloyd.
Hi everyone, I'm Lloyd. I'm an actor originally from Barry, and I've just started work with Hijinks.
So it's lovely to be here again. We come to the conference most years, I think, both down here and up in North Wales. Have any of you seen us here before at previous conferences? A couple of hands going up, lovely. And do any of you know about Hijinks and the work that we do? Yeah, lovely, good. So like Adam said, yeah, theatre company, we also do film, we have community theatre groups, and we also train actors across the whole of Wales, Adam being one of, I think there are about 65 actors that we work with. And our actors are always involved right at the start of any project that we do and throughout, so that their voices and their experiences are all part of it. We're here today, like we have been in previous years, to do a scene for you, which I'll explain a bit more about in a moment. But first of all, because we've all had lunch, and we might all be getting that post-lunch kind of slump, I'm speaking for myself here a little bit, what we'd love to do is a little bit of a thing to wake us all up a bit after lunch. And it would be fantastic if you could all join in on this. It's something called Funky Chicken. I'm guessing by the laughter that some of you know it. Okay. So, for this, if you're able to, and happy to, and want to, if you'd like to stand or do it however works for you, how it works is we go 1, 2, 3, 4, 5 with one arm, 1, 2, 3, 4, 5 with the other arm, then 5 with one leg, 5 shakes with the other leg, then we do 4 of each, then 3 of each, then 2 of each, then 1 of each, and at the end we go, Funky Chicken! As loud as we can. Okay. So it's obviously something very serious and sensible, so I hope everyone's very focused on it. Okay. Is everyone ready to give it a go? Okay. So we're starting with 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 1, 2, 1, 2, 1, 2, 1, 1, 1, 1. Funky Chicken! Excellent, give yourselves a round of applause. Thank you. It's the sort of thing that I don't suppose everybody was expecting they'd do on a Wednesday afternoon, but there we go. Thanks for joining in with that. So we're going to show you now a scene, and this scene involves 2 characters, one played by Adam, and Adam's character is called Darren, and one played by Lloyd, and his character is called Ellis. And it takes place in Darren's house, in his living room. Darren lives in supported accommodation, and Ellis is his support worker. So what I'd like you to do is watch the scene and pay attention to what Adam's character, Darren, is saying and doing and what he wants. Also pay a bit of attention to Ellis, because that would be unfair on Lloyd. And then we'll have a little bit of a chat after it. I'll ask you some questions and we'll see what we think about it. This scene was put together with our actors at Hijinks, where they brought in their own personal experience of situations like this so that we could try and make it as realistic as we could. So I'll be quiet and step off stage, and I'll leave you with Adam and Lloyd.
Darren, my man, good morning, how you doing? Oh man, I feel so energised. Never guess what I did this morning. I swam all the way from Jackson's Bay to the Nap. Yep, and now I am here, ready to work. Healthy snacks, remember? How are you then? What have you been up to?
Oh, you know, just relaxing.
Relaxing. So what shall we do today, my man?
I don't know. What do you fancy doing?
Well, it's your day, isn't it? Could go for a run. You have been saying you wanted to get fitter, haven't you?
Well, maybe a bit of a walk. That would be better.
A walk? Well, a walk's not going to get your heart rate up, mate. I'll tell you what, I think I've got a guest pass to my gym in my bag. You should come down with me. I can whip you into shape.
I don't know. I haven't been feeling too well lately, and I was wondering if maybe we could, I don't know, have a bit of a chat.
Yeah, sure, man. It's in here somewhere, honestly.
I've been having eating problems. Yeah, I just can't seem to stop eating.
Oh, you're serious?
Yeah, I know it sounds silly, but I just can't stop. I think I need to go for an appointment with my GP. My mate Joe suggested that I go for an annual health check. Apparently I should have one coming.
A health check? No, don't worry about that stuff, mate. I found my pass. You just need to come to the gym with me.
I was hoping my GP could refer me to a dietitian.
You don't have to worry about that. Do you know, actually, the best thing, something that really worked for me? Triathlon.
What?
Triathlon. So basically, it means you can eat as much as you like, because you just burn it all off anyway. It's basic maths. I eat over 3,000 calories a day, and look at me. You should join in on my program, man.
Maybe.
Honestly, look, just stick with me, I'll sort you right out. In fact, I think I've got my exercise stuff with me today. No time like the present, we should go down now.
I don't know.
Oh, come on, mate. Carpe diem, seize the day and all that stuff, isn't it?
I didn't like it last time.
What, the gym? Yeah, but you didn't have me with you then, did you, bird? Honestly, we'll do it together. You won't regret it.
I'm not sure.
Well, what else are you going to do, mate? Stand around here moping?
Maybe.
No, come on, right, get your stuff. Have you got some shorts, a vest?
No, I don't.
Okay. Not to worry, we'll get you down there and we'll sort the kit out later, shall we? Yeah? What do you think?
Well,
come on.
Okay.
Yeah? Yes, mate, let's go, come on. Yes, let's go.
Thank you very much, Lloyd and Adam. Round of applause for that. Lovely, thank you. So, we've just seen the scene. What did anybody think of it in terms of Darren and his character and what he wanted and how well the conversation went? We've got some people just down here. Mike's going to bring you a microphone now so we can hear you.
Well, basically, I guess in that, what's the gentleman's name again?
Here?
Yeah.
Darren.
The carer wasn't listening to him. He was telling him how he was feeling, and you have a duty of care. I was telling him how he was feeling, and he wasn't listening to him. He was more interested in what he wanted him to do, instead of coming in, sitting down, saying, how you feeling? How's your day's been? And stuff like that.
Yeah, he was kind of straight into what he thought he should be doing, rather than what Darren wanted himself, and then wasn't listening. Yeah. Does anybody else agree with that? Yeah. Thank you very much. Any other thoughts from that conversation? Maybe over here, Michael? Thank you. Just bring in the microphone now. That's it.
Hi.
Hello.
I thought the staff member was inappropriate because he was moving a lot and forceful, controlling, not person-centred, giving his own opinion, giving his own experience, not engaged, passive, self-indulgent, ignored him and over-friendly.
Well covered.
That sums it all up brilliantly. Thank you very much. Yes, of course.
I think the play was good on two parts of them. But if you are a carer, I think the carer should listen to the person he's caring for rather than himself. So I think yeah, the carer should listen to what the mum wants.
Yes.
So to look after his everyday needs.
Yeah, absolutely. Very nice. Any other thoughts? Yeah, over here. We'll come to you afterwards, shall we? Thank you.
Thanks, Stacey. I just figured, I forgot the gentleman's name, so sorry.
So we've got Darren and Ellis.
Sorry, Darren is not. So Darren, even though he was struggling with his issue, he knew what was better for him. So he had that own idea in his head. It didn't need like a whole board of people explaining to him. He had his own instinct. So I really I'm chuffed with that about Darren. Got the name right. Thank you.
Yeah, you're right, thank you. He knows what he wants, really, but then we've got Ellis, who, as others have said, isn't really listening to him because he's got his own thoughts about what's best for him. But I think we want to come over here next. Sorry, Michael, we're making you yo-yo back and forth across the room.
I thought Ellis, is that your name, Ellis? Yeah. I thought you were quite forceful. So you were forcing Darren to be trained in the gym, basically, when that's classed as discrimination.
Yes, yeah, very good point. Any other thoughts in general, or should we look a little bit more about what it was that Darren wanted?
Can I just say, I think...
Oh, sorry, I didn't see you behind that.
I think it was a classic missed opportunity of somebody's potential diagnosis.
Sorry. I think it was a missed opportunity for a potential diagnosis of something underlying.
Yeah, would you mind explaining a little bit more what you mean with that one?
So earlier when we had somebody come to talk to us from the Paul Ridge Foundation, that was a classic case of not being listened to, and the same thing is happening there. He's saying he's not well, there's something not right, he's got a problem with his eating. So there's a classic opportunity there to take him to see a doctor or whoever it is that needs seeing. So an opportunity missed should never happen.
Yeah, absolutely, and it sort of resulted in Ellis just saying, "Oh, don't worry, we just need to get you to the gym." And he's not a trained doctor, as far as we're aware. Yeah, thank you. Do we think that what Ellis is doing, though, is coming from a good place or a bad place, or a bit of a mixture?
I think it's a bit of a mixture.
Yeah?
Because he probably...
Sorry, I'll give you this one because I'm closer.
He probably means well, but he's not doing the right thing in the long run.
Yeah. Yeah. Yeah, thank you. I think it seems that way, doesn't it? Because, like you say, it seems like he means well, but he's going about it all the wrong way.
Yeah.
And should we just recap what it is we think that Darren wants from this scene? What is it that he's after? We've got somebody at the back there. Oh, is there someone right next to you? Yeah.
I think Alice is doing a wrong thing. It's up to Darren to see what to do. He should listen to Darren's advice first, see what he wants to do.
Yes, absolutely. Listening to what Darren's saying.
Yes.
Yeah, rather than saying what he wants Darren to do.
Yeah.
Yeah, absolutely. And what is it that Darren does want, do you think?
It's up to Darren to say what he wants to do.
Yeah.
I think, anyway.
Yeah, like you said.
Like I said, yeah.
Yeah, wants to see a doctor.
Yeah.
Things, I think.
That he can go to the doctor.
Yeah. What else was in there that Darren was saying that he'd like to do?
Annual health check.
Oh, here we go.
He wanted his annual health check to be done.
Yeah. So he'd like to see a doctor, he'd like to get the annual health check. I think there's, and then he got some feedback there. His annual health check done as well. Yeah, over here. Oh. Are you all right to go, Michael?
Oh, yeah.
Where is she? All right.
Sorry. I was going to go, but I saw that you already know it.
No, sorry, yeah. Thank you so much. Just in the corner there. Thank you.
He said he wanted to see a dietitian and also
just have a chat rather than going in and doing active stuff, because obviously he's...
Yeah, and he was up for going for a walk as well, I think. Like, let's take things a little slowly here rather than going straight into triathlon or whatever else Ellis was saying. So we've got some really brilliant feedback there, everybody. Thank you very much. Give yourselves a round of applause. So we've identified where what Ellis is doing is creating problems, and we've identified the things that Darren really wants. So now what we're going to do is we're going to watch the scene again. But this time, you all have the power to stop it at any moment where you think Darren can say something or do something different to improve the conversation for himself or to improve the outcome. We can't really change Ellis's behaviour. We can only change Darren's and see if that will change Ellis's behaviour. Does that make sense to everybody? Yeah? So we'll watch it again. If you see something that Darren can say or do differently, all you need to do is say, stop, with your hand up, and we'll come to you. Do you have a practice of that? Saying stop? Okay, after 3. 1, 2, 3. Stop! Very nice. Good. One more time. 1, 2, 3. Stop! Excellent. Very good. Thank you. Okay, so when you say stop, we'll come to you with the microphone and find out what your thoughts are. And then it would be brilliant if you feel comfortable enough to come up and take Adam's place as Darren and try out your idea. Does that sound okay for everybody? Yeah? Brilliant. So we'll start that off. The first person to come up will be doing a brilliant job, thank you, and I'll just give one more little instruction at that point. So for now, we'll start watching the scene, and as soon as you see something that you think Darren needs to change, you can put your hand up and say stop. Okay, here we go. And then he should have a nice afternoon, relaxing, watching TV. Yeah, excellent. Let's give him a little bit of a chance.
Darren, my man, good morning, how you doing?
Oh, we've got to stop right off the bat. Who was that? Can you, right at the front, yes.
Tell him you don't like him tapping your back like that all the time.
Yeah? So we can say something like,
I don't like that.
I don't like that. Yeah? Do you fancy coming up and giving that a go? Thank you very much. So what we'll do now is we'll try out that idea, but we won't say stop this time, okay? We'll only say stop when it's Adam and Lloyd on stage. Okay? Thanks, everyone.
Darren, my friend, good morning. Oh, we're mates. We always do that, don't we?
I never like it.
Oh, okay.
Not do it again, please.
Oh, yeah. Yeah, sure. Yeah. Sorry about that. I didn't realise it was a thing for you. Oh.
Fantastic. Thank you very much. Thank you for being the first person to get up and do it. How did that go? Yeah? It was nice and clear. And how did Ellis seem to respond to that? Took it on board? He didn't get too upset by it? No. Sort of took it in his stride. Oh, thanks for letting me know. It was kind of the feeling, I think, wasn't it? Good stuff. So we know that works, so that's pretty good. Should we carry on with the scene from that point, imagining that Adam has just said everything that you just said? And now we've got the power of stop again. So the next time we see something... Before we do that, I've spoken for Ellis here, which is not the best move. Lloyd, how was that?
Yeah, it was really good. Yeah, the point when you said no, actually, I don't like it, it really kind of stops you in your tracks and makes you kind of take the momentum out, so you have to stop and think and change kind of your approach. So yeah, it was really good.
And that's the kind of thing I guess would make the person in Ellis's place think again about some of the other stuff that he goes on to do in the scene and maybe think twice about that as well. So that was great. Right, let's go back into the scene from that point and you can now say stop again.
Right. I feel so energised today. Never guess what I did this morning, mate. I swam all the way from Jackson's Bay into the Nap.
We've got another stop, yeah.
Well, basically, he's not asking him how his day's been or good morning, he's telling him all about himself.
Very nice, yes, absolutely. So what, is there something that Darren can do at this point
Yes.
to get him to stop talking about himself?
Yeah.
Yeah, what do you reckon?
He could just turn around and say, aren't you going to ask me about my day and how has it been?
Very nice. Do you fancy giving that
Yeah,
a go?
go on then.
Lovely stuff, come on up.
We know you will. Never shy.
I forgot to give you the microphone earlier. Would you like the microphone for this bit?
No, it's fine.
You okay? Okay.
I used to act in a bit, so I can speak, project my voice.
Fantastic. Excellent. So just again, we won't do the stop bit now. We'll just see how this bit plays out.
Oh man, I feel so energised. Never guess what I did this morning. I swam all the way from Jackson's Bay around to
Are you going to ask me about my day?
Oh yeah, I was going to ask you.
Yeah.
I was just, yeah, how was your day? How was your day?
Not very good.
Oh no, how come?
I can't stop eating all the time.
Right, okay, well we'll just go to the gym, that's fine. I've got all my stuff, so we can, yeah, we'll
Actually, I was thinking that maybe we can go to the doctors and he can suggest something better.
Oh yeah, but you do, I know what I'm doing. I'll show you out.
Okay, let's hold it there. Brilliant. Thank you very much. That's brilliant, thank you. So that first bit where we tried the different line of saying, aren't you going to ask me about my day? How did that work out? Did it make Ellis behave a bit differently? Yeah. A lot better, did you say? Yeah, it was
Focusing on that, thanks.
yeah. Would you like to just repeat that, just in case we didn't catch it?
It just rammed on about his own day, and when the gentleman said, you're going about your day, you're not even like trying to focus on what I'm going through. And he just kept still pushing his insight on towards the gentleman's, not just factoring in that it's affecting his mental health as well as his physical health. So maybe listen to what he's actually saying and even try it out for a bit. Do a practice run on what the gentleman's saying, as opposed to just forcing your own ideas on.
Yeah, absolutely, and that's a fantastic point as well, because we're talking about physical health, but as you say, if he's not being listened to all the time, that's potentially going to start affecting his mental health as well. So it's doubly bad. But yeah, there was that moment where you pointed out that he hadn't asked you anything about your day, and it seemed to make him think for a moment and quieten down for a little bit at least. Ellis, how was that for you?
Yeah, same as the point where you kind of said, no, actually, stop, take some notice of me. It was, takes you out of that kind of steamroller kind of flow. So yeah, it was really good, really good.
Great, so we're making some progress.
And basically, I'm not being funny, but if I walked into a surface user's house, I saw him slumped like that in the chair and sad, and I'd be quite concerned.
Yeah, even before
I would say, is there anything wrong? And I'd sit down, make them a cup of tea, or help support them to make them a cup of tea if they can make it themselves.
Yeah, as soon as he walks in, it's quite clear. That's a great point. Yeah, lovely. As soon as Ellis walks in, it should be quite obvious that Darren's not potentially feeling great, because like you say, he's a little bit kind of slumped and doesn't have that kind of aura of being, that energy of being...
Especially if the person is usually very energetic. Sorry. Especially if that person is usually very energetic, that's when you notice, oh, this is not quite right.
Yeah, yeah, absolutely. And they seem to have known each other for a while, I guess, so you'd hope he would have picked that up. But it feels like we're moving things on a little bit here. We've only got a couple more minutes, I think, so maybe we can try one more little suggestion. Yeah.
I just want to say, maybe he was saying like he needed to go to the doctors because he went well. Maybe the trainer could be like, okay, come on, let's go, and maybe give him more confidence and going with him to the doctors.
Yeah, that's the position we want to get to, isn't it?
Yeah.
Where Ellis is actually listening to him.
And then maybe ask him about, has he got a health profile he could take with him as well?
Yeah.
So so if he struggles with speaking, they could look in his booklet and like maybe the trainer can act as a carer for that person.
Yeah, and it's getting to that point so that Darren is able to say himself to Ellis, this is what I want and this is what we should be doing. Should we try going back into the scene and try one more little stop before we then bring things to a head? We're not going to get through the whole scene because there's so many different things to talk about, but hopefully we'll have started some thoughts going. So we'll go back into the scene from maybe from the point after your fantastic bit of saying, aren't you going to ask me what my day was like? Okay, does that work for you guys?
Healthy snacks.
Brilliant. You've got stuff ready, yes. Go for it.
I just want to say, like, the character, the person in the chair, could say, like, that belongs to me, what you're doing, like, that's my stuff, what you're doing. And, like, even then, the carer could have the conversation or educate the guy about healthy eating, but still it's his choice. You know what I mean?
Yeah, absolutely. Do you fancy coming up and trying that?
I'll give it a go.
Yeah, brilliant. Thank you. Would you like a microphone? Were you okay? No? Okay. So let's just go back to exactly where we were and give it a go. Thank you.
Hey, that's mine. What are you doing?
I'm just swapping it because we've got some healthy food.
Can't do that.
No, but we're going to be healthy, aren't we? We said we want to be.
Last week in Tesco.
That's okay. You can come another time, but let's eat some healthy food today because that's what I'm here for. Chris, for breakfast.
No, I had a banana for breakfast.
You had a banana breakfast, but you can't eat too many bananas in a day, can you?
So I don't need this, so I can have my breakfast.
Yeah, but we're trying to be healthy, aren't we? So we're trying to go. We want to get out. We want to, get fit. And crisps aren't very healthy.
Yeah, no, but listen, it's my body, my choice. But you're not listening to me full stop.
No, do you know what? Now you said that.
You're controlling me, mate.
Now you said that. I didn't want to control you. Do you know what? You can eat whatever you want. We will have a conversation.
I know my carbs.
You're absolutely right. These are slightly healthier food. So absolutely. Do you know what? No, thank you so much for educating me on that.
That was fantastic. Have you been on stage much? That was superb. I was hoping you might bring out that list you read out earlier and all the things as well. That would have put the icing on the cake. So we basically got through that brilliant performance. We got Ellis going, you're absolutely right. I'll listen to you and it's your choice. Fantastic. We're going to have to draw things to a close now, but thank you all very, very much for taking part in it. Did you say you were after the crisps?
No. The eating issue.
Yes.
The crisps should have been binned, but the banana should have stayed.
Okay. What was, what was that?
I'm just shocked that no one mentioned about his filthy feet on the chairs when he was doing his stretches.
Yes. Another valid point. Get those feet off my seats. Lovely. Well, thank you so much, everyone. I hope you've enjoyed this little session. It's been brilliant to have you involved with it. And I think we've come away with this understanding of that what we've got in this situation is making sure that the character of Darren has agency and can voice what is right for him. Even if it's coming from a good place from Ellis, he's just not listening. He's getting that voice heard. So thank you so much for taking part. A big round of applause for you all. Especially those who came up and did some stuff. And thank you to our actors. And enjoy the rest of the brilliant conference. I should say, I did last year's conference up in North Wales, and within about 10 seconds, I fell off the stage. So from my point of view, this has gone a lot better. So thank you very much. Take care. See you later.
Epic performance, boys, well done. Great trio work, well done. Round of applause again. And also Joanna, well done. Next up on the agenda is some, can you focus on it? You can't be that. Sorry. Right, thanks, Zoe. So next up is the workshop. How the app can help mental health and well-being is in the working wall room. Healthy sex, sexuality and intimacy, Caldecott room. Did you hear that? Yeah? Health, challenges and solution in the conference room, which is here, I guess.
Yeah.
And lastly, improving the vaccine information is in the Monmouth room. Yeah. Thank you.
You got to do it again, Alex. Got to do a workshop again. Hours. Same again. You're doing another workshop, exactly the same as this morning.
Enjoy your workshops. Yeah. And we now have on stage Lisa Morgan and Jordan Smith from Dimensions, who are going to tell us about how Dimensions, the organisation, have worked to make sure people are not taking medicines, to make sure people are not taking medicine they do not need. Please welcome on stage Lisa and Jordan.
Hello and welcome. We've got the last slot of the day, so we've got to inspire you, keep you awake and keep you in your seats, so good luck. We've got a lot to talk about. We're going to talk about it very quickly, so without further ado, we'll just crack on. So I'm Lisa Morgan and I work for Dimensions.
Hi guys, I'm Jordan. I'm a quality consultant at Dimensions.
Okay, and we're going to talk about Stomp and Stamp. Anyone here heard of Stomp or Stamp? A few people, right? Okay, let's explain. STOMP stands for Stopping the Over-Medication of People with a Learning Disability and or Autism, and that's about adults. STAMP is directed more to children, okay? So it's about appropriate medical support. Psychotropic is a long word. Does anyone understand what it means? Yes? Antipsychotic medication, brilliant. So psychotropic medication is something which makes you feel a little bit different. Your mood, how awake you are, how you feel, so it's going to affect your feelings and your emotions. There's a study that in England, around about 35,000 people with a learning disability and or autism are taking these medications, which are antipsychotic, antidepressants, anticonvulsant, mood stabilizers, with no clear reason why they're taking it. Okay? What we're going to do is show you a story of someone that we supported, and it's a little animation, so we'll come back after you've watched this. Okay, we haven't got sound.
It's just what takes people to what he requires.
Yeah, let me go back a bit. There we go.
Frank is a 24-year-old man who lives with two other individuals in a supported living environment. He has an autism spectrum condition, learning disability, uses signs, gestures, or takes people to what he requires. Frank has obsessive behaviours around bedding, clothing, rubbish and food. Frank is overweight and resists exercise. He takes risperidone, fluoxetine and lorazepam to help manage mood and obsessions. He is supported by a core team of 8 support staff. Frank was subject to physical interventions including two-person removal and seated restraint. Support staff also had to use breakaway techniques when you tried to hit them or indeed move to a safer area. Frank's team needed support to develop a positive behaviour support plan and an activity and support plan around his daily and weekly life. Frank's weight was identified as an area of concern. His health, eating habits and patterns of exercise were examined. Observations were carried out, current and past support plans studied, behavioural incident forms and activity levels collated and analysed. During analysis of incidents, it became apparent that the key times were before and after meals and during transition times. The fast triggers identified in the majority of the incidents was a request for food not being met. The fridge was identified as a flashpoint. Frank appeared not to settle until all preferred foods such as cheese and yogurt had been consumed. The resulting behaviour was supposed to have been grabbed, pushed or punched, and environmental damage to walls and doors was witnessed. Anecdotal evidence from support staff indicated Frank used his size and threat of physical aggression as a means of getting additional food items from support staff when out in the community or at home. This was impacting on Frank's learning as he was unable to regulate his emotions and restricting his access to community-based opportunities as he was not able to tolerate shops which had food in them. There was also the use of lorazepam following incidents of high arousal which led him to be more sedated. He also needed to increase his activity levels, firstly to help him burn additional calories and secondly to take his mind off food. Results of observations and analysis were discussed with support staff at team meetings and with the practice leads. The team decided on ways to improve consistency of support involving his community nurse and social worker. Frank has no close family to assist. Frank is a visual person. Although he can read some words and will sign, he preferred objects of reference, and out of sight meant out of mind for him. A second fridge was purchased and located in a separate area he does not have access to. At night, support staff replenished the fridge in his kitchen with the foods for the next day. The fridge became his visual schedule. With this in place, Frank could see that the food was available for the day. He always had toast, butter and jam for his breakfast, a sandwich, salad, fruit, crisps for lunch, snacks such as crab sticks and pickled onions, and then there was different protein, carbohydrate and vegetable dishes for his tea. Every afternoon when he returned home, there would be a snack prepared in the fridge. This helped him through the transition process and bridged the gap between lunch and tea. After tea, he had healthy dessert and was reassured knowing the supper was in the fridge for after his evening bath and prior to going to bed. Support staff reported being frustrated that Frank would refuse to get involved in physical activity and didn't seem to accept that it was important, even adverse to him. This is where the empathy comes in. It was discussed how support staff are motivated to do tasks they do not like and how they feel about doing the tasks. This was important so support staff could see things from Frank's point of view. To get Frank to exercise, we had to build his special interest in, so he swims twice a week, knowing he has lunch afterwards. He does his food shopping once a week, knowing he can self-select from the salad bar and fill his own dish to eat afterwards. He does the recycling and takes the rubbish to the tip on a Sunday, knowing he'll have a small ice cream on his way home. Once a week, after a good walk, Frank goes to the local pub and chooses any he likes off the menu. The result of this approach and the fridge schedule intervention is that Frank has not been held in seated restraint for 7 months. Incidents of physical removal and use of as-required medication have been decreased month on month. Frank stayed the same weight over Christmas and since then has lost an average of £1 per week. Support staff affected have included anecdotal feedback that they enjoy in supporting Frank. They have less anxiety during incidents and have experienced increased job satisfaction through seeing more engaging activities and also losing weight. They're all happy that they have not had to use any physical restraint with Frank, as this has caused both him and them distress. Results we cannot yet see is an increase in life expectancy, but that should be improved year on year as long as this approach is maintained and is indeed successful.
became very attached to when we supported him, and it was a great pleasure to sort of help tell his story. So, the clicker's stuck.
I'll sort you out.
Thank you. Nothing like a stuck clicker. So STOMP is about improving people's quality of life. It's about making sure people only get the right medication for the right reasons and at the right dose. But also making sure that people are involved in decisions about their health, as we've kept on hearing today. So I'm going to click through now to Jordan's view on STOMP so he can tell you his story.
Thank you. I know it's coming to the end of the day, so I'll be quick. But if, like Frank and like me, you're put on antipsychotics or for reasons because of your behaviour or your mood, I think sometimes it's easy for the doctor just to throw pills at you and to like shut you up. But we've heard today, throughout the day, how different things other than medication can be a great help. People's activities, people's friends, what they like to do, giving people real choice and control over their lives. Well, that's the same for medication. You know, I don't really want to be stood here in a year's time telling you that I'm still on antipsychotics, because I don't believe I should be. But like Frank and like others, if we can challenge the GPs and the doctors and the psychiatrists to not give us loads of pills and to do things like gardening, going to the football, stuff that we enjoy, stuff that, everyday stuff that maybe some of you guys take for granted. Some of us just need a little bit of help to do that. I know that medication helps and it does try to make us better, but lots of medication can sometimes make us a little bit worse, and we can present, you know, behaviours of distress. So I would urge you as support workers, as managers, as carers, as family members, to just check with the people that you're supporting what medication they're on, why they're on it, what their dosis is, is that a word? And don't be afraid to ask questions of professionals, because they don't get it right all the time. And if we can replace, if I have any more medication given to me, I'm going to rattle. And I don't want to rattle, but I do want to get better and live healthy. You've seen and heard today that people with a learning disability can die up to 27 years younger than someone without. That's scandalous, absolutely scandalous. And you guys in the room can do something about it. And as I say, I'm not anti-medication, but can we at least try and have a conversation around what else can we do? You know, when you go into a supermarket, we have lots of choices to pick, don't we, of food. I just don't believe that antipsychotic medication is the way forward for certainly the 5 or 6 years that I've been on it. So that's my takeaway message to you guys today. Don't be afraid to challenge in the right areas. Thank you.
It does take a lot to come up and share your story. So we've seen a lot of success. We've still got a long way to go. And as Jordan said, it's not about being anti-medication, because people do need medication at times, but it's about it being the right medication at the right dose and for the right reasons. We deliver training. We've got a lot of STOMP packages together where we help people go into appointments, and our teams help people pull together their action plans to reduce the use of psychotropic medication. I'm not saying that word once more today. So thank you for listening, and any advice, give us a shout.
Thank you, Lisa and Jordan. That was well spoken, and I'd like to say thank you to all the guest speakers and all the workshop leaders. It must have taken a lot of work and effort to make the success that we see before us. So really well done to all of you and your efforts. And I would also like to thank Laura, and a big thank you to all of our speakers, workshop leaders, exhibitors, our sponsors, and you, our delegates today. And before we finish off, I would also like to thank Zoe, Simon Rose, and the rest of the learning disability team for thinking me capable of doing this. Can I ask Zoe to come back onto the stage, say a few words, please? Thank you, Diane. Yeah.
Thank you, everyone. I'm going to keep it very brief because I know we're just running a little over time. We've seen some wonderful good practice examples today. We've heard what people are doing around Wales to ensure that people with a learning disability in Wales are living a great life and living in a country that really values people with a learning disability and ensures that they have good lives. We've also heard the very devastating effects of when we don't look after people with a learning disability, people with a learning disability's health. And we heard from Jonathan about his brother Paul. And it's important that we recognise that that's not the only example of that happening in Wales, and that has happened in the same health board more recently. So we still have huge amounts of work to do if we're to ensure that difference in age gap changes. I'd like to thank the team today for putting the conference together. It's been a long 2 weeks of us being out on the road and doing our North Wales conference. So a huge thank you to Simon, Lucy and Ewan for getting us here today and together and working as well as it does. It's always a pleasure for me to be able to stand here upon the platform that they create to allow today to happen. Also to the rest of the staff who've done a huge amount of work to complement the programme today that you see. But my last thanks has to go to Zara. I spent some time with Zara in Rotterdam about 4 years ago on a sex and relationships project, and Zara was very quiet when she arrived, but that didn't last long. And I saw the wonderful personality who hosted our sex bingo by the end of the 3 days, and we laughed more than we absolutely should have during that week. And I knew that she would be a wonderful chair to take us through today. So a huge thank you to Zara. And my final request is for you to let us know how today has been, the good, the bad and the ugly. We've got some evaluation forms in your packs. And there is a red wall that you won't get past up the back if you do not hand them your evaluation forms. It's really important that we hear from you so that we can, again next year, have a great day together. So please fill in your evaluation forms, and a safe journey home to you all, and thank you very much for attending. Thank you.
Yeah. Wednesday.